Hi, I'm Marcus Simpson with SurgeryPRO. Thanks for joining me. In this video, I'm going to share a couple of thoughts on orthopedic surgery, recovery, and products that are used today to help patients recover quicker, faster, with less reliance on pain meds in orthopedic surgery. So what are the most common orthopedic surgeries? Well, obviously it's foot, ankle, knee, hip, shoulder, right? There are wrist and elbow, but hand injuries too. Spinal injuries, of course, is a major one. But the most common is generally going to be knee and shoulder. We also want to think about sort of the different buckets. We've got athletic type injuries. We've got chronic injuries such as degeneration of cartilage or osteoarthritis. And we've got things that might be related to everyday use, like you step out of the car wrong, you perhaps have been doing something and you shouldn't have been, so you're kind of doing some lifting. Maybe you were an athlete in old days. That would be somewhat related, but you know, we're out of shape. That's true for many of us. Another is work-related, right? So we kind of have these buckets of athletic, chronic, did something and bam, you know, what didn't go right, and then work-related injuries, those four buckets. We have chronic and acute is another two sort of categories and way that we would think about these things. And when we think about orthopedic, we've got sort of low intervention, mid intervention, and high intervention. So a high intervention would be a total joint replacement. The most common is knee, second most common is hip, and third would be shoulder. We're going to see a lot more what are called shoulder arthroplasty in the future. We're going to see a ton of knee and hip total joint replacement or arthroplasty. We already seen about 500,600,000, I believe, today in knee replacements. That'll be doubling and then tripling and then quadrupling in coming years. We also have a lot of meniscectomies. A very large number of people have gone through one or more knee scopes, as they were, and there's questionable data in terms of whether or not this helps people in the long term, helps a lot of people, but there are other surgeries like an anterior cruciate ligament, which is a very common injury in a young athlete, even an athlete in their 20s and 30s, and it doesn't heal on its own. So if you're in your 50s, your surgeon may say, we're not going to do the ACL, we're just going to let it be. But for a 30-year-old, there's a good likelihood that they're going to want to do that repair. And then, of course, in the shoulder is a very complex joint, and the injuries can be quite complex. The surgeries themselves are very complex, but the number of people going through this surgery is on the rise. And the most common that you might have heard of would be a rotator cuff repair, it's a lot more involved than the name suggests. There are many variations, and there are many different types of things that can go wrong with the shoulder, and many interventions. With the foot ankle, we have issues with falling, and we have issues a lot of times with trauma from something. Generally, we're going to be thinking about like falling on ice or tripping therein. So that's a little bit of the overview, and of course I forgot spine. Spine surgery is a lot regarding disc degeneration. We of course have genetic issues in terms of scoliosis and other related sort of spinal diseases, but we do have a lot of just loss of cartilage as we age, spinal compression leading to fusions or discectomies, that's a disc removal, and we are going to probably see increase in volume therein also. So that's kind of a little bit of the overview of sort of how you might think about orthopedics. Now let's think about, so you've been to an orthopedic surgeon, you've been evaluated, surgery is the best option for you. Perhaps you've exhausted conservative approaches such as physical therapy, cortisone shots, other types of injections, perhaps the natural and sort of less invasive approaches are out the window. You've done your exercise, you've lost your weight, all those kinds of things. So surgery is now your primary option. Well, a large percentage of surgery is going to be done on an outpatient basis. Sometimes you'll be held overnight. That's true in a lot of cases. And with total joint replacements, oftentimes you'll be held for 2 or 3 nights. We're going to see same-day outpatient total joint surgery soon. There are some facilities that are doing it. For the most part, if you're having your hip, knee, or shoulder totally replaced, you will be inpatient for a couple of days. A lot of those percentages, perhaps half of those patients, will go to rehab facilities as well, otherwise known as skilled nursing facilities or SNFs, sometimes also called rehab homes. And then everybody else, just about all shoulder repairs, most ACLs, meniscectomies, hip scopes, foot ankle repairs, hand surgery, some of the spinal cases like discectomies, it's outpatient surgery. Even if you're lying in a bed for a couple hours to recover, it's not uncommon for all of that stuff to be done close to a hospital, so you can be transferred if you need to, but it is outpatient. It's obviously much cheaper when it's in that environment. So you've got medications you're managing after the surgery. You've got rest, the standard RICE, right, which is rest, ice, compression, and elevation. You've also got nutrition you need to manage. You've got your mental mood and your emotional state, very important. You need to relax. You need to sleep. And sleeping, I think, is underrated in terms of its clinical importance. I think it's a lot more important than generally people think it is. And then you've got pain management. And you've got inflammation management, you've got physical therapy to think about, and then obviously getting back to walking and back to work eventually. So let's kind of break down some of those pieces. So you've gotten home from your surgery, and probably the most important thing for you at this point is simply to rest. So how do we rest? Well, we might be immobilized, right? So our say we had a knee surgery, our knee may be in some sort of soft type cast, and it's not a cast, but you might think of it like a cast. It's generally called immobilizers, and it's rods and some Velcro, and it closes with some Velcro straps, and it basically keeps your legs straight. If you had a shoulder surgery, you'll probably be discharged with some sort of sling. Sometimes that's also called an immobilizer, and it may have a pillow, which would be called an abduction pillow, or it may not, right? So you just may be hanging there, it may be out, maybe to the side, could be in different orientations. You might have a more substantial brace or a cast of some kind. Functional, which has the ability to rotate, so hinges, or non-functional would be more fixed. A lot of variations, and many physicians and surgeons will follow their own protocols. But so here we're home, we're lying in bed. Now we've got to think about fluids, hydration, right? Because we've probably been fasting prior to the surgery. We might have been under a lot of stress. We do need to think about nutrition. We should not be just going out and eating the first thing that we think of, and probably going and eating real food as opposed to processed foods. So thinking about macronutrients, phytonutrients, thinking about plant nutrition. And if you're big on animal protein, you do want to think about going a little bit easy on your colon, so maybe animal protein that's slightly more digestible and less likely to stop you up, because one of the side effects of the pain meds is often constipation. So having some good fiber is going to be helpful for you in terms of moving mass through your GI system, as well as a lot of those phytonutrients that can generally be found in fruit and vegetables. So we want to obviously help your body heal that injury. We don't want to restrict by having, eating just Ritz crackers the entire time we're recovering, or just eating, so for example, all dairy, or, we really want to mix it up. So that would think about that. Now, in terms of sleep, the one thing that's really going to keep us up from sleeping is, anybody want to guess? Absolutely, it's pain. Of course, it's pain. So now we've got medications. We've got low-level medications. We've got high-level medications, right? Your low-level medications are going to be your meds like Tylenol with codeine or some sort of opiate or opioid. And if you want to know technically on that, opioid is the natural, I believe. Hopefully I'm right on that. And opiate is the synthetic. I might have that reversed. But opioids are generally what we consider drugs like Percocet, hydrocodone, oxycodone, morphine, and that class, so Vicodin, etc. And there are variations. Methadone is another one. I may go back and give you another full video on opioids, but the bottom line is that these meds have different chemical pathways, and they work on your brain, sometimes on the central nervous system, sometimes on the peripheral nervous system. And then on the lower end, we've got, the Tylenols may not do it for us. I mean, we may be in some pretty severe acute pain. So if the meds work, great. And most everybody is going to be taking those meds following these types of surgeries. But there's a problem with the meds, right? There's problems in terms of nausea, vomiting, itching. There is a dermatitis that can result, sort of rashes can result from the meds. There are issues with long-term use and short-term use. We want to reduce the total length of time we're on opioids, and for many people, they don't even want to screw with these drugs, so they'll try and take as few as possible. In some cases, they'll take none. Now, sleeping, which is where I started, you got to be able to sleep. So if you're not sleeping, you might want to think about some sort of drug to help you, perhaps a muscle relaxant, a painkiller. You need to hit those deeper stages of sleep in order for rest, recuperation, and healing to occur. You've got to get your stress, your cortisol levels down in terms of having a faster recovery. So that's something to consider. There are non-pharmacologic approaches, and those would include, predominantly, these are going to be compression therapies and cold therapies, which have been shown to work and been used throughout history for a long time and are used in all sorts of different applications. We do a lot of that as a companion, sometimes in place of the opioid medications. Very, very well trodden, and we'll have some literature for you. Movement is very much about inflammation, right? The less inflammation you have, the more you're going to be able to move. The more you move, the less inflammation you're going to have. So think about it like a sort of a yin-yang. These are sort of interacting components. So again, the more you move, you're going to actually be treating inflammation in general. The less you move, you're going to have your body's muscle pumps are not going to be moving that fluid and helping to diurese excess fluid or urinate it out. But yet, if you're swollen, you're going to be likely in pain. So that pretty much goes hand in hand. It's not 100%, but a lot of times after soft tissue injury or controlled injury like a surgery, you are going to swell. Now, during that swelling, your body sends a ton of stuff, fresh blood flow, fresh oxygen, lymphocytes, phagocytes, I mean, all this stuff that's designed to treat that injury. So some people will tell you, you know, don't screw with the inflammation. You actually want it there. And I don't, we've heard a lot of conflicting things. I'd love for somebody to set the record straight, but our basic understanding is that getting the inflammation down after orthopedic surgery is advantageous, particularly because it helps people move more quickly. They get into physical therapy faster. They get on their feet faster, and this does seem to be correlated with faster recovery. So how do we get inflammation down? Well, we get it down by not adding to the inflammation, right? Not causing further injury. Resting does get inflammation down. Inflammation will flow with gravity, so there's the elevation. Inflammation can be moved through compression. That's massage, sometimes pneumatic compression. That's a air-filled pump. We'll see those a lot on calf and feet, as well as the joints. And then movement, where the muscles are contracting to hold the body up. And, you know, even when you think about doing a shoulder where you do the sort of the pinwheels or the rotation selective exercises, you're activating muscles, and muscles move fluid. And that would be a major, major element of recovery. So everything that I know, which is not a lot, but it's a little, is that if you can get inflammation down, it's going to help you with pain, and it's going to help you get moving, right? Get into some sort of, to be able to do the exercises that you've been prescribed and to get into a physical therapy regimen. Not everybody is going to be prescribed physical therapy, but if you are prescribed it, you should seriously go, because they really know what they're doing. And recovery from surgery is very much a science. It's not an art, I think, at this point. We know what works, and the therapists are just really well trained in pushing you beyond the levels that you might have stopped if you were on your own. And that's really important when you're dealing with particularly things like the shoulders. You know, just hard to break through those barriers. And so that would kind of be a little bit of a way, you know, from start to finish. We've got an injury. What are the different types of injury? The inpatient versus outpatient surgery, very common today. Nothing to really be too worried about. This is, it happens. You can avoid it by having, you know, to be flexible, have endurance, have strength, focus on your body, tall, great posture, and eat well, and try and lose weight. I'm looking at you, kid. That's me, in other words. And you know, this is where we are. And it's a great place to be. So the U.S. remains probably it's one of the greatest places in the world to have these kinds of things. We take you in, take you out, but if possible, stay out. And if you are going to go through a surgery, check out some of the other videos and the products that we have here. But that would be a little bit of an overview in terms of how to think about an orthopedic surgery. And we'll go into some more detail in another video, like more specific ways to manage pain, and specifically things that might be acute side effects, such as venous thromboembolism, which is blood clots and DVTs. Okay, thanks so much for watching. On to the next one.